Welcome to Group 2's review of the ACLS and PALS H's and T's. When evaluating someone with cardiac arrest, discovering the cause of the arrest can mean the difference between a life saved and a life lost. This can also be a period of high anxiety and frustration. Let's review the H's and T's that need to be analyzed during a cardiac arrest. The first of our H's is hypovolemia. Some of the symptoms to be watching for is loss of fluid volume, decreased blood pressure, tachycardia or bradycardia. You will see responsiveness to fluid challenges, anxiety, cool clammy skin, and pallor. Hypoxia. You will see oxygen deprivation, capillary refill of more than 3 seconds, dyspnea, fatigue, cyanosis, nausea and vomiting, and a decreased level of consciousness. The next H is hydrogen ions, which means that your patient is acidotic. You need to watch for some confusion, fatigue, dyspnea, sleepiness, and ketoacidosis, which would be sweet-smelling breath. Hypoglycemia. You may see blurry vision, fatigue, shaking, confusion, a rapid heartbeat, headache, sweating, loss of consciousness, nervousness, hunger, skin tingling, and you may see seizures. Hyperkalemia. You may see some dysrhythmias, a weak pulse, fatigue, muscle spasms, tingling, or the patient may collapse. Hypothermia. The patient may be shivering, have a lack of coordination, slurred speech, some confusion, fatigue, a weak pulse, and slow breathing. Now let's move on to our T's. Tension pneumothorax. You may see a deviated septum, anxiousness, dyspnea, diminished breath sounds, hypoxemia, central cyanosis, hypotension, tachycardia, profuse diaphoresis, and decreased chest expansion. Cardiac tamponade. There may be a falling systolic blood pressure, a rising venous pressure, pulsus paradoxus, narrowing pulse pressure, muffled heart sounds, or distended neck veins. Toxins. On the ECG, you will see a prolongation of the QT interval. Other physical signs would be bradycardia, pupil symptoms, and neurological changes. It's a good idea to support circulation until an antidote or reversing agent is obtained, and also the poison control can be utilized to obtain information about toxins and reversing agents. Finally, we have our pulmonary and coronary thromboses. A pulmonary thrombosis is a blockage of a main artery to the lung. On the ECG, you will see narrow QRS complexes and a rapid heart rate. Physical signs would be no pulse with CPR, distended neck veins, positive D-dimer test, and a prior positive test for DVT or PE. A coronary thrombosis is a blockage of blood flow within a coronary artery causing an acute or massive MI. During PEA, on the ECG, you may see ST segment changes, T-wave inversions, and Q waves. Physical signs would be an elevated cardiac marker on the lab test. Before we end our presentation, we would like to share with you a little jingle that you can sing to yourself to remind you of your H's and T's. Enjoy.
Hypovolemia means your blood volume is low. Acidosis, you have too many giants. Hypoxia, you are too low on O2. Bulimia, keep high or low. Hypothermia, when your temperature is cold. Hypoglycemia, when your blood sugar is low. Toxins are the drugs you put into your blood. The heart strangles or tamponade. Tension pneumothorax moves your trachea to the side. Thrombosis when blood to the heart is denied. Thromboembolus, your lungs are full of clots. Remember your H's and T's. seconds.